Good morning, everyone. Today in Diagnostics, our topic of discussion is microbiology. And microbiology, basically, we are going to talk about, of course, organisms like what is gram staining and about different microorganisms. So uh, now we know that what is the importance of microbiology. To give you the overview of this condition, you have done like you will be doing microbiology in pathology, and or you had done microbiology in pathology, and in that one we study all the parasites, we study the bacterias, viruses, fungi. So simply, um, what is the importance of this thing is, um, you can say, infections. And infections are very common, and of course, like the infections, they are caused by bacteria as well as the viruses. It um, can be caused by fungi, okay, and can be caused by parasites or the helminths and all the stuff. So infections, they cause wide spectrum of human illness. And now I'm talking about all the infections which we get on our daily life basis or in the clinical practice. Now, of course, whenever someone have infection, um, like these days, COVID-19 is a virus, is an infection as well. So, depending on which area you are practicing, of course, there are some of the infections which are endemic, like um, malaria, like dengue, like any other XYZ condition. So, of course, like they are endemic in certain regions. So, whenever we are dealing with any infection, um, we do the evidence or we practice the evidence based medicine. We always think like this way, or we always think logically what could be the most common reason of this presentation. Okay, and again, like one of the example is in front of us. Like right now, in all over the world, whenever anyone is getting a respiratory illness, so um, especially pneumonia, so they like especially pneumonia. So what they suspect like is um, pneumonia due to viruses, or you can say the COVID-19 or the coronavirus, right? So now, the point here is what diagnostics play a role in this thing. That's the important point what we are going to discuss. So there are certain group of people who are more prone to infections. For example, immunocompromised people. And immunocompromised people are those simply where their immunity is not fine. For example, patients or people are those who have HIV, for example, who are getting chemotherapy or radiotherapy, for example, okay, or even like uh, two old people plus anyone who have chronic diseases, anyone who is on immunosuppressants, like like the people who have kidney transplant and all those things, plus anyone who is taking steroids, for example. So um, all these patients, or like, yes, there are, and primary immunodeficiency syndromes, okay. So like these are all the people who are immunodeficient and or immunocompromised, and they are prone to get more and more infections. So now the important thing is whenever anyone have infection, I'm not now talking about a typical infection. For example, the infections can be of any place. The infection can be of skin, can be of GIT, can be of lungs, can be of brain, can be of heart, can be of kidneys. It could be a UTI. So of course, or it's a simple upper respiratory tract infection. The infections can be of any type. So of course, some of the infections which we deal in our daily life in clinical practice, for example, if someone is coming with upper respiratory tract infection, or someone is coming with the very, very common infection. So, of course, we go for empiric therapy. So, what is empiric therapy? When we know that, okay, by our previous knowledge or what we practice as evidence based medicine, so we know that, okay, this type of infection is most commonly caused by this kind of bacteria or this kind of virus. So either we have to give treatment or we don't have to give treatment. And if we choose to give the treatment, so what kind of treatment should be given to these patients? Or you can say empiric therapy is the best guess which is made logically in this case. So now you can say that, for example, I will tell you um, diagnostics guiding treatment. Okay, I'm just heading it myself. So, for example, someone have, I should give you an example which you can, okay, urinary tract infection. Okay. Now we know what is the most common cause of UTI? It's E. coli. Like more than 90% of the times, it is E. coli which causes UTI. So now anyone who will present with UTI, okay, so what we must do, of course, we must take their urine sample. And when we have taken their urine sample, what we must do is we can send to the lab for testing, and the lab can tell us, okay, this person have this kind of organism, but of this thing is time consuming. So, for example, we will make a best guess and we will think that, okay, trimethoprim is the best drug, okay, to treat a UTI. So see what I'm doing basically, because I know that E. coli is the most common organism, so I know that, okay, trimethoprim is the antibiotic which I must give it to the patient who is showing the symptoms of urinary tract infection. So this thing, but of course, if a patient is coming back, the same patient is coming back with UTI, and simply that trimethoprim doesn't help him. So now I must think about that. Now this is something which looks different, right? So maybe then I will go for further investigations. So by the way, one of the general rule is, yeah, we don't start antibiotics before getting blood samples, or not just blood samples, rather blood, urine, stool, whatever samples you want to take, or CSF. Of course, you have to take them first and then start using or giving the antibiotics. So this is always important. Um, you can say it is appropriate to collect the sample. Now I'm using the word sample because I'm talking generally. Okay, it could be of any part. It could be blood, it could be urine, it could be a CSF sample before initiating um, antibiotic therapy. Okay. Now, basically, and from where to collect the sample? The answer is simply this thing: to have the best chance of identifying the causative organism. You can say the samples should normally be taken from the body site that is affected. Okay, so this is the best way. For example, if the infection is of the skin, so you can take a swab from that part of the skin, or from vagina, or from oral mucosa, or from nasal mucosa, or of a blood, or a urine sample, or a CSF sample, XYZ. So the most common samples which are collected in the practice can be multiple, and it could be sputum, it could be um, urine, it could be feces, okay, it could be uh, um, blood, it could be genitals, it could be mouth, it could be even synovial fluid. It just remind me of septic arthritis, for example. So of course, like pus from any site, okay. So like of course CSF, right? So like any sample can be taken. So when the organism is in the blood, we call it a septicemia, okay. So of course, like that's the reason we go for septicemia, or we check the blood, either the organism is present in that one or not. Okay, so now one thing, guys, which I am not sure how much concept you have about gram positive, gram negative, but the good thing in infectious, my first lecture which I gave you, I talk about the most common gram positive, gram negatives, gram positive cocci, gram positive rods, and gram negative cocci and gram negative rods, right? So infections with bacteria are very common, okay. And once a sample containing, or a suspected sample which is containing the bacteria have been collected, so there are two ways by which we can identify the organism. So what is the way you can say whenever we collect the sample, um, identifying the organism? So after collection of sample, two ways by which we can identify the organism. One is of course microscopy. So of course, like by microscopy, we check either um, what shape of the organism is. It's a cocci, it's a rod, it's a cocobacilli, and XYZ. So, and most of the time, this microscopy is done after gram staining. Now, if you know what is gram staining, I already explained you this thing in infectious, that we use that crystal violet, saffron, alcohol wash, for the staining purposes. And depending on the color, we name them, either it's gram positive or gram negative, or it is acid, like it is difficult to stain organism, right? So we call it as gram staining simply. And as you know, like the organism which stain blue, we call it as gram positive, and those who stain pink, we call it as gram negative. And then, like the other thing we notice is the shape. That is like either it's a bacilli, either bacilli means rods, or either it's a cocci, or either it's a combination of that. Okay, and whatever is the shape, of course, how they appear, either it's in clusters, either it is in chains. So uh, this is the thing which we check. So Again, this is a very quick way, by the way, by which you can identify the organism, or at least identify the group of the organism, like from which group this organism belongs to, either gram positive, gram negative, right? So, because most of the common organism, they are identified according to their staining and according to their shape, okay? And then they try to grow them, culture them. Culture them means what? They try to grow them. So, based on the growing habitat, for example, if the organism is aerobe, so they grow best in oxygen-rich environment. Wherever if the organism is anaerobe, so they grow best in oxygen-poor environments, and that's the concept, by the way, by which we say like this is a aerobic organism and this is an anaerobic organism, right? Now, of course, like some of the organisms which are difficult to stain, so we do some special staining, like Zeal Nielsen staining, which is used to detect tuberculosis, and that's why tuberculosis is Mycobacterium tuberculosis is also called as the acid fast bacilli, because Mycobacterium tuberculosis is a difficult to stain organism, and they cannot be stained by the normal, you can say, staining methods. So, of course, like depending by the end of this thing, we must know now either it's a gram positive cocci, gram positive rod, or gram negative cocci, or gram negative rod, or simply gram positive negative coccobacilli, which have like um, more or less the same shape, right? And then the aerobes and anaerobes. So whenever they culture, so this one is like how they're culturing the organism. So what they do, like they basically like culture is simply they take that organism which is to be identified, and they uh, place that sample on the growth medium. So this is like a growth medium. So different organisms or different bacterias or all these things, they tend to grow in different mediums. So of course, like there are different agar medium and there are different mediums. So our discussion is not that right now, but what I want to tell you, like they are going to spread that bacteria in this petri dish, okay, and then they will give some time for the organism to multiply. So after the multiplication has taken place, like the microbiologists, you can say they use different techniques for identifying the particular type of bacteria. Now, this is a time-taking procedure. It can take days or weeks, okay, and like several days, you can say, for many bacteria. So, like identification of tuberculosis can take up to weeks. So, of course, in certain conditions we can wait for the results, but in certain conditions we cannot wait for the results. So that's why we have to start the empiric therapy. So, but what is the point of doing this thing? Because it is going to give us the exact organism that this organism is causing this kind of condition, right? So once the bacteria are cultured, then what they do, they check the sensitivity, and that's why it is called as culture and sensitivity. Okay, this is the reason the name of full test is culture and sensitivity. So what they do, they put different drugs, and they see the action of the drug, like either that drug is acting against that or that bacteria or not. Okay, so there could be three outcomes. Number one, For example, okay, this is a test result. So see, numerous mixed flora indigenous to this site scant Staphylococcus aureus methicillin resistant. Like this is the result, and this is a susceptibility result. So what they do, see, they put a lot of drugs, okay, and then they put R resistant, clavamox resistant, cephalothin resistant, but chloramphenicol susceptible, gentacin susceptible, floxacin resistant, ofloxacin resistant, penicillin resistant, and sulfamethoxazole susceptible, tetracycline resistant, erythromycin resistant, clindamycin susceptible. So they give us the result like this. So R is for resistant, S is for sensitive, and there can be one more outcome that is called as I. I means what? Intermediately sensitive. So see, if I will get this kind of blood report, what I will be doing, I will choose any of the antibiotic to which that organism is sensitive to. Okay, so whenever, for example, if someone, like, again we will take the treat, like the example of this one, this patient which I was telling you, a UTI. So if the patient will come and he don't have any effect of trimethoprim, and till that time I already got the result, so I will see which drug have the best action against this organism, and then I am going to choose that drug for that patient. And once I will start that drug, of course it is going to kill that organism. So for example, uh, maybe the patient organism is not E. coli, rather it's some other gram negative organism like Proteus. So then I will see what kind of drug is acting against Proteus, and then I am going to use that. So this is like the point, or the thing, what you can say, which um, I wanted to like convey you the concept of, right. So there are two terms which I want to discuss over here. Is one is called as um, MIC, and one is called as MBC. So what is MIC? MIC is basically minimal inhibitory concentration. And what is MBC? MBC is basically minimum bactericidal concentration. So okay, maybe these terms maybe you will not find too much in the books, okay, because like this is more pharmacologically related. So basically, it is desirable to have more information about the organism sensitivity to a particular antimicrobial agent, whatever is that. So, for example, if there is an infection which is very difficult to treat, okay, and that infection require, you can say, a prolonged use of antibiotic. For example, a very good example for that can be infective endocarditis. So, infective endocarditis, you know what happens, like what we do, we also ask them this thing, MIC or MBC. So, for example, they will perform the test and they are going to work out the minimum concentration of the antibiotic which is needed to stop the bacterial growth. Okay, so they will give us this value, like you must achieve this much concentration of that drug to kill this organism. Okay, and or you can say they will calculate this one, like this is the minimum concentration of the drug which is required to stop. See, it is inhibitory, inhibit. So this is bactericidal or killing. So to kill the bacteria. Okay, so they can give us the MIC and MBC. And of course, like this data is very good when we have to give the medication for a long period of time, because we have to maintain either this dose levels or this level in the blood to kill that organism effectively. So, by the way, here if you will see, like, here they have written Staphylococcus aureus. So remember, like, or you have seen, like, Staphylococcus aureus methicillin resistant. We call it as MRSA, MRSA. What is MRSA? It is basically uh, methicillin resistant Staphylococcus aureus. So what is this one? Like, this is an organism which is simply a gram-positive cocci, but what is the problem with this one? That some of Staphylococcus aureus, they are methicillin resistant. Now, to tell you, like, methicillin is not used in clinical practice nowadays because it have a lot of side effects. Okay, rather methicillin is simply penicillin. So what, when they say methicillin resistant Staphylococcus aureus, it means like this organism is not going to be killed by oxycillin or nefcicillin or neftazoxylline, like what all the groups, all these groups. But this is basically the first drug which they test for against this organism. So that's why it is also called as MRSA. But you can also call it as NERSA, nefcicillin resistant, or ORSA, like oxycillin, because it is not going to, they are not going to act against that. So whenever there is Staphylococcus aureus which is methicillin resistant, okay, so in that case we must choose some medication which are effective against Staphylococcus aureus. Okay, so or maybe like we require different antibiotics to kill this one. So you can say uh, like whenever we send the samples to the labs, they always check for the Staphylococcus aureus, especially for the MRSA. Okay, so like Staphylococci are of different type. Okay, but Staphylococcus aureus or methicillin resistant is, like, you can say, the resistant type, which doesn't, like, on which the conventional penicillins, they don't act. Okay, so now um, not just this way, but there are many other ways also available, or there are many other methods also available to detect the bacteria. Okay, so but like most of the time the clinicians, they just go onto the past knowledge, or you can say all the evidence which we had now. Now again, guys, like, you also are doing infectious disease. So if I will ask you a patient of community acquired pneumonia, CAP will come to you. So what is the most common organism? See, you must say Streptococcus pneumonia. Okay. Same thing, I must ask you, for example, what is the most common cause of UTI? So the answer must be E. coli, right? So of course, like, this all information comes from the clinical knowledge we have. But of course, like, whenever it is hospital acquired, whenever it is some XYZ infection, so we must think about other things. Okay. So what are the other ways to detect the bacteria as I was talking about? For example, we can do genetic testing. Okay. Why? What genetic testings do? They check the genes of that bacteria, like the DNA or the RNA in sample. Nowadays, PCR is very, very, very common. What is PCR? Polymerase chain reaction. And polymerase chain reaction are those, like, which assist in doing genetic testings in the patients today, these days. Okay, PCR. And if you know, like, the COVID-19, they are doing the PCR as well, but that is a virus. We are talking about bacteria. Okay, so now, a lot of information should be there. What other diagnostic tests we can do? You can say other diagnostics for infections. Now, if you are good in immunity, or if you have done immunity carefully, like, there is IgM, immunoglobulin M, and there is Ig, immunoglobulin G. And we do serological tests, we check IgM and IgG. And nowadays, what they're doing, again, I'm giving you example of COVID again and again, but if you know, like, these days they are running a lot of investigations in many countries, and they are checking the IgG in the patients. Like, simply if the patient was previously infected, so they must be developing IgG. So these are serological tests to check the or to detect the antibodies to various organisms in the patient's blood. So remember IgM, they tend to rise early in the disease. They rise early in the disease, right? And whenever it is IgG, so remember, like, they are the one which are going to, um, or you can say the levels rises later. Okay. So if we detect, for example, IgM of certain bacteria in the blood, so it means like this bacteria is the cause of that illness. But if we found IgG, uh, so maybe the IgG antibody level would be expected to elevated in the patient who have a previous same illness, right? Or, for example, if the patient is immunized to that condition, this could be one of the conditions. So you can say like IgG sometimes is difficult to interpret because it is difficult to distinguish between the current infection and previous exposure on a single level of IgG. But the best use of serological testings, which I'm talking about, is in the measurement of acute, what you can say, acute conditions or acute patients. Okay. So, for example, if you want to make sure like this IgG is due to current illness, so what we can do, we can check the levels um, during the acute illness and again after recovery. So we can see like either the levels increase or either the levels are same or either the levels decrease. Okay, so for example, if there is too much rise of the antibodies level to certain microorganism in the patient recovery, so it means like, that particular organism is the cause of that infection or that specific pathogen is the cause of that infection. So there are some downsides, what you can say, for these kind of testings as well. So of course, like, there are many other testings which can be done in the patients. um, what we do, like, um, remember light microscopy, so not just bacteria, like even fungal infections. Okay, fungi, even the protozoas, like, one of the very famous conditions is malaria, right? They can also be identified on microscopy. And that's why, like, if we are suspecting malaria in any patient, what we do the thick and thin film or peripheral blood film. And viruses are mostly detected by viruses can be seen by electron microscopy or electron microscope. Of course, like, viruses are very small, they cannot be seen by ordinary microscope. So that thing. And by the way, nowadays, many of the problems are solved because we can do the antigen testings. Like, whenever someone have hepatitis B, we can do the antigen testings. We can do a PCR, and of course, the PCR is going to give us the full genetic code of that particular virus or of particular anything XYZ thing. For example, I will give you the example, like, they are talking about like all the world is working on the vaccine. Why? Because they said like the Chinese researchers, like, when the infection was started, they released the genetic code of that virus worldwide. So what they did, like, they did a PCR and they see like what is the sequence of their genetic material, and then they spread. So the viruses, they can be detected by this thing. Okay. So, and nowadays they are also developing rapid kits, okay, to identify different bacteria because cultures are time consuming. So serological testings are fast, cultures are slow. Okay. But everyone have their own downsides. So simply, this thing we can do in the patients, and this is how it helps us in diagnostics, right? So I was giving the example of UTI for, like, by the way, I gave the example of UTI, and nowadays, like there is a yes, that's good. I already talked about that thing. Um, Open that part, that UTI part. I like, or there is my lecture about urine dipstick. So nowadays, urine dipstick is available. So again, like they can just take a strip and they can dip it inside, and they can easily get, what you can say, either they have any infection, or either they have any glucose, or either they have any ketones, or XYZ different things, can be detected easily. Nowadays, this is very fast way to in detection of the things. So that's all, guys, for this thing. I hope you enjoyed and you liked the lecture. So I will see you next week with more topics of diagnostics. Thank you so much.